The resurgence of measles in the European region is a stark warning of the consequences of declining vaccination rates. According to the World Health Organization and UNICEF, measles cases in the region reached 127,352 in 2024, marking the highest level since 1997 and more than doubling the numbers reported the previous year. This dramatic rise is not just an alarming statistic. It represents a direct threat to public health and a failure to maintain the immunization levels needed to prevent outbreaks of a disease that was once considered under control. The situation is particularly concerning for young children, as those under the age of 5 accounted for 40% of infections. 500,000 children missed their first dose of the measles vaccine in 2023, a critical failure that has left thousands vulnerable to a highly contagious and potentially deadly disease. Measles is not a mild childhood illness. It can lead to severe complications, including pneumonia, brain inflammation, and even death. Infants, pregnant women, and immunocompromised individuals are at even higher risk, making this resurgence an urgent crisis rather than just a temporary setback. Experts are placing much of the blame on the decline in immunization coverage during the COVID-19 pandemic, when routine vaccination programs were disrupted. While some countries have managed to rebuild their vaccination efforts, many have not yet returned to pre-pandemic levels, leaving gaps in herd immunity. The European region now accounts for 1/3 of all global measles cases, a shocking reality that exposes the failure of public health systems to ensure adequate protection against preventable diseases. The WHO warns that most of the region has fallen below the critical 95% vaccination rate required for herd immunity, meaning that outbreaks will continue and likely worsen unless immediate action is taken. Some countries are facing even more dire circumstances. Bosnia and Herzegovina, Montenegro, North Macedonia, and Romania reported vaccination rates below 80% in 2023, placing entire populations at risk. In such environments, the virus can spread unchecked, infecting not only unvaccinated children but also those who are too young to receive the vaccine or those whose immune systems cannot mount a strong enough response. These outbreaks do not remain contained within borders. Measles is highly contagious, and cases can quickly spread across countries and continents, creating global health risks. The message from health experts is clear: vaccination remains the best defense against measles. A fully vaccinated individual has a 97% chance of avoiding infection even after exposure, yet misinformation, vaccine hesitancy, and systemic failures in public health continue to leave large portions of the population vulnerable. The consequences of inaction are severe, not only in terms of individual suffering but also in the overwhelming burden on healthcare systems already stretched thin by other infectious diseases and chronic conditions. This crisis serves as a crucial reminder that no disease is ever truly eradicated without sustained effort. The resurgence of measles should not have happened, and the fact that it has underscores the dangerous complacency surrounding vaccination efforts. Without immediate and decisive action, such as targeted immunization campaigns, stronger public health messaging, and policies that ensure access to vaccines, this outbreak will only escalate. What is happening in Europe should serve as a warning to the rest of the world. Without vigilance and commitment to vaccination, diseases once thought to be under control can return with devastating consequences.